Well, good morning. We're pleased to be here in Thorncliffe Park, and I'm joined, of course, by our Medical Officer of Health, Dr. Eileen Davila, and a number of people from the neighborhood office and from some of our health partners, as well as the Toronto Paramedic Services, the TTC, Michael Garron Hospital. And this is really, again, it's an update for us on the overall COVID situation, but also an opportunity for us to show you some of the things we're doing with respect to vaccination. And we've very much benefited from all these partnerships all the way through with different people helping us to get this done. Today's Thorncliffe Park Clinic is the most recent of 19 mobile clinics supported by Toronto paramedics in Don Valley West. The team runs clinics Wednesdays and Thursdays from 11:30 in the morning until 3:30 in the afternoon at different locations across East York, at Flemington Park and Thorncliffe Park. The 19 clinics have administered more than 500 doses of COVID-19 vaccine. We are making great progress at getting people vaccinated, and that is something we can all be thankful for as Thanksgiving approaches. More than 81% of eligible residents in the City of Toronto are fully vaccinated, and more than 86% of eligible residents have at least their first dose. So we are well on the way to our 90% target, but the clinics on these buses are going to help us to get even closer and closer and eventually reach that goal. The work to get people vaccinated is not stopping over the course of the upcoming holiday weekend. I'm proud to announce today our VaxGiving plan. We want people who aren't vaccinated already to take the opportunity to get vaccinated over the course of the Thanksgiving weekend. And that is why we're promoting all of the places that you can get vaccinated right across the city. More than 18 Team Toronto VaxGiving clinics are being held starting today and into the early part of next week. This includes a number of Toronto Public Health walk-in vaccination clinics at malls, TTC stations, schools, churches, libraries, and even a late-night pop-up in St. Jamestown. All of these clinics are in areas where we are working to drive up vaccination rates, which are lower than the average in the rest of the city. We're going where the data says we need to go and where we know that these locations will be easy for people in those areas to visit. That's the point of the micro-targeted, hyper-local vaccine push, to go where we know people still need to get vaccinated and make it as accessible and as easy as possible for them to get vaccinated. Beyond these clinics, I want to remind people that, of course, there are numerous pharmacies across the city with appointment and walk-in vaccination opportunities that are also open over the weekend. Our VaxGiving push will also include the start of several weekly recurring mobile clinics starting next Tuesday and running through next week at the following locations, so they will stay open for some period of time at those places. They are the Main Square Community Centre on Main Street in the Beaches, East York area from noon to 4 on Tuesday, Amesbury Park Library from 2 to 6 p.m. on Tuesday, the Black Creek Library on October 13th from 2 to 6, O'Connor Community Centre on October 14th from 2 to 6, Pelmo Park Community Centre on October 15th from 2 to 6, and Dawes Road Library on October 15th from 2 to 6. These 6 weekly recurring clinics will return at the same time and on the same day of the week every week for the foreseeable future. Their location and the fact that they will remain in place reflect the fact that two-dose full vaccination rates, for example, in some of the neighborhoods surrounding these clinics are lower, say as low as 61% in some of the surrounding neighborhoods of these recurring clinics, compared to an overall citywide rate of 81.3% of eligible residents. So you can see these are areas where we have a substantial ground to make up, to catch up to the city average, let alone make it to 90%. And that is why we're going to have these recurring clinics in these places at the same time, on the same day, each week, as far as the eye can see going forward. This is all part of the steady progress we are making and have to continue to make to get people vaccinated. As I've said before, we have vaccinated already millions of people, but we still have thousands to go. So on the one hand, it's still a big challenge for us, but on the other hand, it marks the huge progress that we have made. As of October 4th, 236,000 more Toronto residents need to be vaccinated to reach the 90% coverage of eligible residents. Of these residents, 131,000 have received their first dose. More than 49,000 of those residents are eligible for their second dose right now. We are in fact making progress, but it's the kind that requires great perseverance. For example, in the last week, approximately 1,800 Toronto residents that were overdue did in fact receive their second dose. This is very good news. And this is really a testament to the efforts that we and our health partners are undertaking to provide people with the opportunity to get vaccinated. We just have to keep repeating that news over and over again and try to increase that pace. And that's why we're taking the steps that we're sharing with you today. More clinics, clinics remaining in place in challenging areas on the same day at the same time each week, more buses being used with the wraps that you see to draw attention to them, and other kinds of things that we can do to make vaccinations more accessible and more noticeable, the opportunities to people. We are down to the very most challenging part of this campaign now, and I can assure you my own resolve as mayor and the resolve of our entire team remains very strong. We will take these already leading vaccination numbers, they are leading in many contexts, even globally, and get the rest of the way to where we need to be. So this weekend, if you're not vaccinated yet, please take the opportunity to get vaccinated. Come out to one of our VaxGiving clinics and get vaccinated. Getting vaccinated now will give you freedom. You'll be able to dine in at restaurants. You'll be able to do that, and you'll be very glad you're able to do that in the months of December and January, just to pick a couple of examples when the weather will change. You'll be able to go on and cheer on the Leafs or the Raptors or even your kids' hockey games. You'll be able to attend a concert, enjoy some live music, and support our artists. These are all things that require people to show proof of vaccination. And you will also help people get back to work and stay in school and stay at work. Alongside my determination to see our vaccination campaign through, I'm increasingly focused on Toronto's necessary economic recovery, especially for our small businesses and restaurants and underground shops, just to name three groups that need to be back in good health. And in order to be back in good health, they need customers. Those customers will be there when people believe it is safe. And people will believe on a more widespread basis that it is safe to patronize those businesses when more and more people are double vaccinated. That belief will come faster and be stronger when we hit 90%. And that will be good for our health, and it will be good for the economy. And you'll know we've done the most important thing we can do right now to protect ourselves, to protect our loved ones, and to protect all of the progress we've made. If we don't want to go back to lockdowns and other kinds of restrictions, and I think we all very much don't want to do that now, vaccinations are our best friend to stop that from even being a possibility. Thank you to every member of Team Toronto, all of the members of Team Toronto, all of our health partners, all of the community organizations, the paramedics, the TTC workers are all helping us to get people vaccinated now, over Thanksgiving and beyond. We're also thankful for the work of everybody involved in the vaccination effort, and that will already ensure that this holiday can be a bit more normal than we're perhaps experienced last year, as Dr. Davila will discuss this morning. And you know, next Thanksgiving, if we keep working at this, we can have this entire pandemic behind us. So I would now like to invite Dr. Davila to deliver her remarks for today, and then we'll take questions.
Thank you, Mr. Mayor, and good morning, everyone. Naturally, this latest vaccine outreach strategy has my full support. We knew that closing the gap on vaccinations would be a race where the final leg was won in small increments. Anyone who gets their first shot at one of these clinics will be able to complete their vaccinations in time for the December holidays. I think we can all agree that this is one of the times of the year where gathering together means the most. To be able to gather in person with the confidence, with a superior level of protection against COVID, is something you simply have to experience for yourself, as literally millions of Torontonians now know. So if you are eligible for vaccination and come across one of these clinics, or seek out a clinic opportunity at toronto.ca, do yourself a favor and get it done. There is another development that lots of people are thinking about these days, which is the province's plan to provide for rapid antigen testing in locations where the risk of transmission is high. Local public health units have been given the job of delivering the testing as directed by the province. For some health units, this creates a capacity for testing that was, until this time, extremely limited. In Toronto, we're fortunate that we have a robust and comprehensive testing delivery system for schools that is already up and running. Our current testing program is an essential component of Toronto Public Health's contact and outbreak management system, which includes PCR take-home testing. The PCR tests that we're using have a high level of accuracy. At present, take-home PCR test kits are available to all schools across the city for symptomatic individuals and exposed cohorts. Toronto Public Health will take full advantage of the ability to enhance our existing program, which has been functioning successfully already for several weeks. And we look forward to further details and then finalizing the integration of the rapid antigen testing capacity the province announced with our school board partners. Finally, I've seen data recently that suggests that weddings are a distinct source of COVID-19 infections. Since September 24th, there have been 5 confirmed chains of transmission linked to weddings in the province. Now, we all know weddings are a happy time. People are relaxed. People are gathered close. Emotions are high. And it feels safe. When we get together, it's easy to let our guards down. And it's a similar situation with the upcoming Thanksgiving holiday weekend. Today is the last chance I will have to speak with you prior to that holiday. Whatever way you're planning to celebrate, please take into consideration the vaccination status of those participating and any others who may be attending who, because of age or health, may be more vulnerable to exposure or risk. Vaccines are the most powerful and effective means we have to be as tough on COVID as it has been on us. We still have to be consistent in how we mix and who we mix with, doing as much as we can without taking on more than we should. We have a lot more to be thankful for this year than last, when we could only be hopeful for vaccines. Now, we have access to them, and they are making it much easier to plan wisely for this Thanksgiving holiday. With that, I think we're going to open it up for questions. So let's start off with Thanksgiving first. Certainly what I'm suggesting to people is to ask about vaccination status. And we know that gatherings of people, one, are better smaller than they are larger because more people means more risk. Having unvaccinated people or people whose vaccination status is unclear also gives rise to further risk. So certainly having gatherings exclusively of those who are vaccinated is the safest. Where there is some degree of concern around unvaccinated individuals or where vaccination status isn't clear, reduced risk can be achieved by having more outdoor focused events. I think we can get creative around what it means to get together for Thanksgiving, and certainly having outdoor events and getting together, which is really what Thanksgiving I think is about, can be done more successfully and more safely in an outdoor environment if we're talking about people who are unvaccinated or for whom vaccination status is unclear. And finally, I think the last thing I would say for people is, look, as much as we want to be together, during the holidays and during the Thanksgiving weekend in particular, to the extent that you have symptoms of any kind of illness, better to stay at home. and celebrate virtually if you have any kind of symptom that may be consistent with COVID-19. I think it's the safest thing for yourself and certainly for everybody around us. When it comes to Halloween, again, the advice is quite similar. Vaccinated individuals, gatherings of vaccinated individuals are the safest at this point in time. It's all the same principles. Outdoor gatherings are definitely safer. They're not no risk, but they're certainly lower risk. That being said, if there are unvaccinated individuals or where vaccination status isn't clear, better outdoors and best really to be safest with a mask and physical distancing in that context. So that's a great question. In respect of how things are going from a COVID-19 epidemiologic perspective, we certainly have seen some stability over the course of the last few weeks. And this is a good thing. We've seen case rates holding at, a little over 100, say between 100 and 150 weekly cases per 100,000 population. This is, again, a good thing that we're seeing. We've also seen that hospitalizations, ICU admissions holding relatively steady. However, I would caution, getting overzealous or overexcited about where we might be going, simply because we have yet to see the full impact of the return to schools in our data reflected fully. And as well, we note that when you look at mobility around the city, one doesn't need to see the data to just experience that people are moving more and more around the city. And this certainly gives rise to the potential for more transmission of disease.
Well, I think anybody who looked at the effort that I made with respect to this vote will know that it was considerable. And I made the calculation, together with others, that to have lost this policy completely because it was defeated by the council would be a worse result than to continue to do the work we're continuing to do to very much keep it alive and bring it back for what I hope will be a positive result, because we have an affordable housing crisis in the city. This is one way in which we can both deal with that by having this option available to people in lower incomes or just people who need this kind of housing, and at the same time address some of the complaints that we receive day in and day out from neighborhoods where these rooming houses are presently not regulated, and as a result, we have very little opportunity to deal with them when they're causing problems in neighborhoods. And so we're going to continue to do the work. I would just say that if you look at it, as much as there were some who spoke about this with I think, undue vehemence, the fact is there are people from all points on the sort of ideological spectrum who voted different ways on this. You had people who normally you would expect to be strong advocates for this kind of affordable housing, adamantly and vehemently against this policy. And I'm trying to fix that. I'm trying to make sure that we gather together a reasonable consensus of councillors that can allow this to move forward. But, when you are faced with a choice about losing a policy entirely, again, because it's been brought forward time after time for 13 years, I'm determined to see this policy put in place. And so I took the action by moving the motion that I did, that I believe stood the best chance of having this actually implemented for the benefit of tenants looking for housing across the city. Well, we know when the main ones are going to come out. They're coming out not because I would like to take them out. If people wanted to sit in December and have dinner or lunch in those Cafe TO installations in the city streets, I would be happy with that, were it not for the fact it's going to snow. Much as we might hope it's not going to snow, it will snow. And we've done the calculations based on both how long it takes us to take them down and when we might have to start clearing snow. And obviously, if you had these patios, cafe to patios on the streets at a time when it snows is going to cause a very bad situation. So they will be taken down on November the 1st. With respect to people on the sidewalks and other places, I'm hopeful many of them decide. We don't have any feel for that yet, but I'm hopeful many of them do decide to stay there. Again, we have a challenge with snow clearing there as well, but I think there are ways we can work around that more easily than on the streets. And so we'll see how it goes, but the date for the ones to come off the lanes of traffic will be on November the 1st, as per the schedule. Well, the enforcement part of this, if you want to call it that, is going fine. And when I say I misspoke myself, I gave you an accurate number in saying there were 500 total complaints that had anything to do with vaccinations or anything to do with vaccines. In fact, the number of complaints in the first week of the vaccine passports was 300, so it was quite a bit less. And many of those were just people phoning in their observations about what they saw or didn't see going on. I myself, over the course of the weekend, I think was asked for my proof of vaccination 5 times at different things I was at, ranging from a baseball game to a restaurant. And it happened quickly. It happened without incident because I saw many other people being asked, especially at the baseball game. And I understand the fact that it's required some staff resources to be allocated from the restaurants to actually make this happen. But in most cases at restaurants, there's somebody who greets you at the door anyway, and it just takes 1 minute longer for people to show the proof and to show their identification. And so I'm not up to speed as of this morning on how many tickets, as it were, have been issued. But the fact is that out of those 300 complaints, there have been a number of educational discussions and warnings that have been given to people because largely it is complaints that drive the enforcement activities. But I will just say that I think so far it has been quite smooth. And that is because businesses are cooperating, and I thank them for that because I know it's a bit of an extra effort. And the people have been cooperating. There have been very few of these incidents involving people being aggressive or intimidating, and I hope it stays that way. That's the Toronto way of doing these things. Well, I think what you're seeing is an uptick, and I base this on just anecdotal information that I'm getting with respect to the number of people who, for example, are going to indoor dining, the number of people who felt comfortable to go to a baseball game. And I think that that reflects the fact that as people see this policy in place, they know that those who they'll be indoors at the restaurant with, or those who they'll be at the theater with, or those who they'll be at a sporting event with, are also double vaccinated. And I think that's giving people a degree of comfort that they can go safely about these activities. And that's very important for their well-being generally, but it's also very important for the well-being of the economy and for these businesses that have been struggling. And so I would say if you combine that with the fact that we've had relatively few incidents of any note and that actually relatively few complaints in a huge city like this with millions of people and thousands of businesses, I'd say it's going quite well. I guess we'll hope it stays that way. Going once, going twice. Doctor.
Spoke on one of my numbers, so if you don't mind. David, you had asked a question about what the case situation was like, and I realized that I misspoke as I stepped back here. So we are seeing roughly a 7-day moving average of about 100 to 150, depending on the day, of daily cases, and our weekly incidence rate per 100,000 is hovering at around 35. So I just wanted to clarify that number and make sure that that data were clear.
Thank you all.
Thank you.